Good afternoon. My name is Kevin Kirkpatrick. I am the CEO of Avery Professional Group. We are a healthcare recruiting firm, work with physicians and other healthcare providers. Today, I have the amazing Carly Cox, who is the physician recruiter for YukonDOCS, as well a representative from CASPR, which is the Canadian Association of Physician Recruiters. So Carly is in the know about physician recruiting. So what we thought we'd do today is chat and let people learn a bit about us. So Carly, can you do me a favor and tell me a bit about what you do?
Yeah, great. Thanks so much for the invitation to even chat today, Kevin. As Kevin mentioned, I am the physician and locum recruiter for YukonDOCS. So YukonDOCS is a program that was funded through the Yukon Medical Association. So the Yukon government had a permanent recruitment position for a number of years. And then when COVID came about, that position was no longer in place. So we've gone about 3.5 years without a physician recruiter. So the YMA took it upon themselves to be proactive and be able to offer support of locum recruitment to our physicians. So that is how my position came about.
Awesome. How long have you been working with them?
So YukonDOCS, I started from scratch. I was contracted to create that program. And it has been only in the works for 20 months now. So we're very, very new.
Excellent, excellent. What do you find are the biggest challenges to, well, actually, I'm going to change the question. What has been the biggest challenge in starting something from net new?
Well, I mean, without a doubt, one of the biggest challenges is once you get yourself and your community or your territory out of the recruitment game, you're already behind, right? So now I feel like we are playing 3 years of catch up to essentially compete with our other neighboring communities, provinces, territories. So that has been a big challenge because it's just getting the word out there, really showcasing that we have the recruitment support available now. So that was a big piece of it. And then getting the trust of the physicians, of course, is always a big piece, no matter what community you're recruiting in. So I have tried to work as closely as I could with our local physicians, and they're fantastic. But making sure that they understand that I'm here to help them and to really support their needs.
Excellent. I have to say I've seen a lot of the YukonDOCS stuff on social media and stuff like that. So it looks like there's been some great work on branding and getting the word out. Have you seen much success through those efforts?
I have. I really have. Social media has been a fantastic marketing tool for YukonDOCS. I feel personally that we have a very engaged Instagram group. So not just, getting the likes on our pages, but actually an engaged group that are reaching out, asking questions. My physicians are always, sending me photos of hikes they've been on. So they're engaged as well. And I actually, just in the evenings, sometimes I spend some evenings just going through, Instagram, trying to find somebody that I feel based on their profile might be a good fit for the Yukon. And I'm actually talking to someone right now that has never actually locumed in the Yukon, but is always considerate it and just didn't really take that next step. So right there, perfect example of how social media can be incredibly beneficial to recruitment.
Well, and it's interesting because I obviously I spoke at the CASPR event back in the winter, I think it was, about social media because we use it a lot. So it's good to see somebody that's doing that as well, because I don't think that as many communities and organizations are doing it as much as you guys are. So that's an interesting opportunity, right?
Absolutely. And like I said, it's the engagement piece. And I know you spoke about, you really spoke about the importance of this at the CASPR conference as well, but not just getting those likes, but getting the shares, getting the questions, and that engagement piece is really how you know that you're somewhat successful on social media.
Yeah. What if you were let's say I'm a physician and you're giving me your 30-second elevator pitch, why would I come to the Yukon?
Well, so first and foremost, I mean, you come to the Yukon because it is breathtaking. So going back to kind of how I became in this role, I actually work remotely for the Yukon. So I live in Southern Ontario and I work remotely for them. Never having been to the Yukon, I was one of those people that really wasn't sure what to expect. Now I count the days till I get to go back every time. Like it is a different way of life out there. It's slower, it's peaceful, the fresh air, breathtaking scenery, of course. But honestly, it's the people. It's Whitehorse in particular is like a cosmopolitan city. Most of the people there are from everywhere else. So really, really interesting people that care about the environment, that take care of one another. Like it's really become a lifestyle up there more than just, the adventure that I think people see the Yukon as.
Nice. Do you find that a lot of people that locum start to consider it on a more frequent or potentially a permanent basis?
So as YukonDOCS is only 20 months old, I mean, we have had successes where locums have, become permanent physicians. Oftentimes I see that more in our rural and remote communities of like Watson Lake and Dawson City. But I would ultimately like to see more of it. So for me, it's, getting our locums to spend a longer period of time here, not just, 2 to 3 weeks. So spending a longer time where they get to maybe enjoy more of the lifestyle aspects to it. And then really creating that like ultimate locum experience for them. So getting some social pieces in for them, getting, a hike, a dog sledding tour, whatever that may be. But then also as part of my role, I always take on like the spouse and family piece as well. So, would you need childcare? What would that look like? The Yukon has phenomenal schools, absolutely incredible schools. So speaking about pieces like that, making sure they're connected with their colleagues, all of that, right?
Excellent. My phone rang and now I lost my next contact. I should have put it on. Vibrate. Sorry. So I have the luxury of following you on both Facebook and Instagram, and I'm not going to lie. The images of the Yukon make me want to travel there. Travel there as well. So obviously, you recruit family physicians, but do you do specialist locums as well?
I do, to a certain degree. So usually in the specialist situations, I'm just a matchmaker. So, reach out to me and then I will pass you along to that specific department. Okay. Most of the recruitment is done kind of internally on those ends. So family physicians, hospitalists, and emerge docs are kind of my core.
Okay, thanks. How are you finding? I mean, I have a lot of clients looking for emerge physicians and stuff like that. How are you finding it? And are you guys having success finding emerge docs?
It's a challenge.
Yeah.
Like it's a challenge across Canada, right? Yeah. It definitely has been a challenge, and we have only 3 full-time emerge docs, and the rest are physicians who have a clinic and then do some emerge or hospitalists alongside that. Okay. And that's just, what we offer our physicians is very diverse practices. And a lot of, family physicians love that they get to have, a full scope and a very diverse practice. But it also puts challenges and more strains on the emergency department because we can't rely on those full-time staff. Right. So yes, I mean, you'll see a lot of emerge only locum ads that I put out, definitely. But I think we're a very fortunate group, like 54% of our physicians are in the 31 to 40 age gap.
Nice.
So we're lucky enough that they're still in touch with their medical school colleagues, with their residency colleagues. So I do get a lot of connections that way.
Good.
Which is, I think that's very beneficial and paying off.
Well, and it's interesting because I've been doing this for a while. I'm not saying how long, because I don't want to age myself. But it always seemed interesting to me that how tight-knit physicians are in general, right? I remember one year recruiting an ENT, and then the following year recruiting another ENT who knew the ENT from the year before, and then a third ENT because he knew the two ENTs before, right? And it's been interesting that, I believe, and I think where someone like yourself is going to excel too, is that, you have that ability to provide a seamless experience for them, because, and I know this because, I've been exposed to you enough that you provide that seamless experience that they're going to tell their friends about the week they did, or the 2 weeks they did in Yukon, and, how it was, financially rewarding, but also experientially rewarding as well, right? Because I think what I find is a lot of these smaller communities, the support that the physicians have in how they communicate with each other and support each other is much greater, right? Than being in a large academic center where, you're faxing some unknown specialist that you don't know. Whereas, in one of the hospitals I worked for, I used to joke that I would roll my laptop up and down the halls because it was easier than setting up meetings, right? So what is the biggest challenge for Yukon? Is it geography?
I mean, yes, for sure. Honestly, what I hear the most is the paperwork piece.
Right.
So just one more license they have to get, more paperwork. And if they're really only planning on doing, 1 to 2 locums that year, does it make sense?
Yeah.
Right. Yeah. And I'm a huge advocate for the national licensure. And that's partially because, recruitment in the Yukon we will reach so many more people.
Yeah.
The opportunities will just be expanded. When you come up to the Yukon, every physician that comes before they can be licensed has to take a First Nations 101 course.
Oh, nice.
Around cultural safety. So very important. But again, it's one more course, one more piece of paperwork. So that is honestly one of my biggest challenges.
Yeah.
Of course, the geography piece, but that's what I hear most is I just can't fathom doing all the paperwork right now.
Yeah, it's interesting. I did a blog post to my subscribers today about pan-Canadian licensing, right? And I shared an article that I think Andre Picard might have shared it on LinkedIn, because it's true. Like, and I hate to use the word gig economy, because it has somewhat of a lesser connotation than you would expect for physicians. But if I want a locum as my full-time gig, and I want to control, I'm going to work for 3 weeks here, 3 weeks there, you have the ability to diverse those physician manpower hours across a broader spectrum. But you're not going to do it now if you have to have 12 licenses.
Right.
And each license is going to cost you $1,000, plus you're going to have insurance. Like, it prohibits it, right? But if I can work from home and work when I want to and stuff like that, and when I don't want to, we should expect the same type of thing from physicians. This 1950s 3,000 patient roster physician working 6 days a week is unrealistic, and I don't think we've created any changes in the training system to account for the fact that in Ontario, a lot of the clients I work with have an average of 1,200 patients on their roster.
Yeah.
Right. So we're not creating or training enough physicians to come for that, right?
Right. So I haven't had the chance to read your article. I did see it shared, but I haven't had the chance to read it yet. But no, I agree. And I think it's just when you think about it too, from the rural and remote community perspective, I think you would get so much more exposure from physicians if, the licensing piece was not such a barrier.
Yeah.
In the Yukon, we do reimburse like your housing, your travel, all licensing, and your CMPA.
Nice. Excellent.
So we do try to kind of support that extra effort that you have to put in and those fees you have to pay.
Nice.
But sometimes it still just comes down to time.
Yeah. Well, and timeliness of how much leeway you get too, right? Like, and I think that's the hardest part. If someone needs a locum within the next 2 months, it's so hard to get a physician through the process and identify someone within that time frame too, right? So, I think it's smart that it's something that you're continually focused on and building a talent pipeline for Yukon that will allow that, right? So I'm going to flip the switch a little bit on you. Yeah. And I would ask, can you share with people that are listening, because there might be physician recruiters that are listening, but can you share a bit about Casper and the benefits of joining Casper and talk a bit about that? Is that okay?
Sure, yeah. So Casper stands for the Canadian Society of Physician Recruitment. And what we are is an association of physician recruiters across Canada. And these are not-for-profit recruiters that are working for hospitals, communities, municipalities, associations, those sort of recruiters. And what we do is learn from one another. So we share best practices, we share different resources. Oftentimes we even share candidates. So if I have someone that is not necessarily a good fit for the Yukon, then I will just share it in our little WhatsApp group that we have. And there's a lot of communication that way. We really work together as a collegial team to, one, work towards bettering overall healthcare within Canada, but then also finding that right fit for a physician. So Casper recruiters operate under a code of conduct. So I always encourage any new medical student, resident, new grad that I talk to make sure they're talking to a Casper recruiter. You're going to get the same ethical approach across the board, no matter which recruiter you're talking to. And it's just it's a lovely organization that really supports our membership.
Well, and the nice thing too is the last conference in 2023, you had some great speakers and stuff like that, other than myself. There's immigration lawyer there and other aspects. So the thing I found, and I was a Casper member prior to being for profit, and there's a lot of exchanging of ideas and exchanging of solutions to issues, right? Because there's a really good chance someone else has faced it in the past, and and all of the Casper members I've ever dealt with and worked with, have been professionals. Like this is their calling. It's almost a bit more than just a career, right? It's a calling for most of them, and it's a great way to to learn from each other, right? So Carly, what's the easiest way to find you? If I'm a physician and I want to hang out in the Yukon, as I should, and go find Carly on Instagram, obviously, is YukonDOCS, but how can they find you directly?
You can find me on LinkedIn. You can email me at carly.cox@yukon.ca. And text is always best for me. I love a text message. Excellent.
Well, Carly, I thank you very much for spending some time with me. Anybody out there, I vouch for the amazing professional that Carly is, and I mean, you guys should get to know her and follow her. All right, everybody, have a great day.
Thanks, Kevin.
Thank you.